name's Dr. Mark Ott. I've been practicing in Florida here for 6 years, and our practice focuses primarily on diabetics. We also take care of patients with other endocrinological problems. My father is a diabetic, I should say, and I've watched how it's affected his life and what it's done to his health and how he's deteriorated and the effects that it has on everyone around. And that was really one of the biggest passions. I didn't want to end up in that same boat myself, and I definitely didn't want my kids to end up in those shoes. So I kind of decided to focus my education, my research, my time into learning how to really fight this disease, and so we've really focused our practice in that area as a result of that. We watch patients in this office on a regular basis reverse their diabetes and actually be able to claim a non-diabetic status. They many times are able to get off of their medications, and they're able to eliminate the effects and the way that diabetes is really stealing their life. So yeah, that happens on a regular basis. It's not 100%, nothing is, right? You can do enough damage and let things deteriorate enough that you can't get all the way home, but in many cases, in fact, more than I'd say a real strong majority of our patients are able to accomplish those goals. Do people that are on insulin feel like once they're on it forever? I think that's exactly what people think. Once they start taking insulin, I think they watch themselves. The problem for people is that their lives become their proof, right? And so they watch their insulin levels rising, on a yearly basis. And every time they go back to their doctor, they find that they're needing to have to take more because their sugars are less and less controlled. And so, it's very rare that I meet with a diabetic who's insulin dependent who thinks that they can get off. Good news is a lot of the time they can. It's not uncommon at all for us to watch people put their insulin away. As time goes on, we always make sure that they're managing those things with their prescribing physician who put them on it in the first place. But the great thing about insulin is that most patients who are taking it are on a sliding scale. They know how to moderate their own. They've been taught, how to moderate their own insulin levels based on what their blood sugar readings look like, and they're able to just taper it way down because they have to. What makes our practice different is really that our primary objective with our patients is to get to the bottom of why. We really want to understand what are the factors causing an individual to have dysregulated blood sugar. Why is your blood sugar, if you're the patient, where it is? Why is it uncontrolled versus why is the next person's? Because we find that patients are not alike. Physiology differs from one to the other, and what may be primarily adrenal in one patient as the primary driver could be completely different in another patient. Could be primarily liver, or could be pancreatic, or could be a number of things. Could be infections sometimes, could be a gut problem. GI disturbances, oftentimes big parts of it. So you really have to investigate an individual's case and figure out what are the causative agents in this patient so that you can tailor treatment to an individual. And when you do that, you can start producing individualized results that hit the targets. If you hit the targets, if you can see the targets, you certainly have a better chance of hitting them.
Rhonda? Good.
Good morning, Charles.
Sure.
Welcome. It's nice to have you with us.
So, is it? You mentioned earlier that the doctors weren't taking the time to do what they needed to do as far as the time spent with the diabetic.
Mm-hmm.
What? Obviously, do you see this as something that's going to continue to escalate out of proportion, or do you see this as something that we can actually kind of stem? What do you think about that?
I believe we can stem this. I think diabetes is out of proportion right now, epidemic proportions, because of what people don't know. A lot of people walking around with diabetes now and they don't know they have it.
Yes.
So if not so much the doctor not spending the time, there is not much time when a patient comes in to see a doctor. what we try to equip that patient or client with is you need to walk in with at least 3 questions.
That's right. That's right.
All right. I understand I have diabetes. You know, what is this diabetes? What can I do to manage diabetes? At least 3 questions. And, you know, what can I eat or not eat besides my medication? Now, when those questions are asked, that's the time when the doctor would refer in our clinic. Would refer that client to the educator. And then when they come to see me, I have at least 30 minutes to an hour I could spend with that person.
This is Ann Richter. Ann is one of our long-term volunteers that make the clinic operation work and make it successful. And Ann is Charles Maddox.
Well, how about doing a quick test on me since we're...
Well, sure. Breakfast being our most important meal.
I know.
You mean
Look
to
at
tell
her.
me you
Look
haven't
at her.
had
She's
your meal?
beating me down. I was going to stop, but I couldn't.
Oh dear. Well, I tell you what, I always have. I go over to that little section where there's food, and I always have a few things in here for people to eat.
There you
They
go.
haven't had their breakfast. And so, do you check your blood sugar every morning?
I do. I do.
Okay.
And it's been... Use this. What is
Okay,
this?
I'll show you. It's so you'll love it.
Okay.
So, do you use alcohol usually?
No.
No, you
But
don't.
you could. I mean...
It's you know,
Yeah.
sometimes around the clinic here, it's you know, you don't want to pick anything up. Then we always dry it off, and then you just, you haven't done that. I'll just show you. Just put it right there and go.
Ooh.
Does that hurt more than yours? And then we just wait till we get the little drop. That's plenty. More than
Is it?
enough. Oh yes. We had a little beep. And there you go.
Let me see it before the camera sees it. Come on, come on. Stay in the hundreds. 102. 99.
Oh, 99. Terrific.
Wow,
Very good.
what did I do?
Yes, well, no breakfast.
Well, it's supposed to be a little higher in the morning too, as well. But I think you know, and what I've done is exactly what what I want to show other people to do is to eat right and do what you need to do to reverse this disease, especially in the early stages.
Right.
Because if we don't know, if you don't test, if you don't know you have diabetes, because I could have easily went another year
Yes.
without knowing, so that's what I thank you, and you've been a plethora of information.
Would you like some applesauce? I usually give my... Yes, so just a little unsweetened applesauce is really good in the morning. Yes. I'll go get you some. Okay, take care.
Hey, Walgreens. I'm kind of liking Matt here, but I'm kind of allergic to Bruce. Got any ideas?
Try 24-hour Zyrtec for prescription strength relief from your allergy symptoms, indoors and out. And right now, when you buy a Zyrtec 45 count, you can get a 14 count free at Walgreens.
Hey, Miss Whitfield.
Hi, Charles.
I'm Charles. Good, good,
I'm
nice.
glad to see you.
I'm glad you allowed me to come to your home.
Well, thank you so much for coming.
Yeah.
My husband
Okay.
is in here.
How you doing today? Before you go, how's he holding up?
He's doing fairly well, but he's not at his best, But he's just kind of sitting there, not kind of knowing what to do under the circumstances. So that's why we're so glad that you did come. Just talk to him. Mr. Whitfield. Mr. Charles is here. This is Mr. Whitfield.
Okay. Hey, Mr. Whitfield. Pleasure meeting you today.
You too.
Yeah.
Okay.
Okay.
All right.
Yeah.
Okay.
Give me your other hand.
Are you guys just finishing up?
Yes, we have one more exercise to do. All right, do me a favor. Shrug your shoulders up and down 10 times. 2, 3, good. 4, 5, keep going. 6, 7, 8, both shoulders. 9, one more. 10, very good. Take a deep breath. Good job. All right, reach back for your chair and have a seat.
How you doing, Miss Whitfield?
All right.
Good. So we kind of wanted to just come here and hear a little bit about your story.
Yeah.
I'm making a film on diabetes right now, and Suzanne told me you had diabetes and wanted to kind of see what was going on. And can you tell me a little bit about how it's been for you with diabetes?
Well, long as where I have my feet, they hurt me, and then they don't see like getting well. When his feet hurt, they hurt so bad that I don't know what to give him. I called his doctor, and I explained to her that he was having this terrible pain in his feet. He couldn't sleep. He couldn't do anything. She said to just give him pain pills because there was nothing else they could do about the pain. This is something that comes with diabetes, and I guess she's saying we have to learn how to deal with it, So it kind of put me in limbo because he takes a lot of pills, but I understand that those pills are for his blood pressure, not for his diabetes. The only thing for his diabetes is his insulin. So she said to give him Advil or whatever, but this doesn't really work. It might calm it for a few minutes, but he deals with this pain a lot.
When I started, he was sitting on a folded pillow, which increases the pressure, and it causes more harm than good to the healthy tissue in the decube. And so what was happening is he was sitting on a cushion where he should have had a pressure relieving device, some type of cushion that provides either a change in pressure or an actual cutout, because he has a bad wound and he's diabetic. And he did not have a cushion. He was sitting on a chair, folded pillow, which is a contraindication, but that would have not been caught because of lack of education. And I just happen to be a therapist who specializes in pressure relief. And so it was something that I targeted in on, but not all therapists would. It's just a lack of training with diabetic patients.
I was asking him, is there anything that we can do? Is there any kind of doctor or any kind of person that you want to see that we can help? Is there anything that we can do for you guys?
See this?
Oh, okay.
So he can get out of that chair
Yeah.
and out of the house.
Okay, I got you.
This chair right here. Oh, I didn't know you were going to bring the camera.
So, basically, this needs a motor.
Yes, that's what I'm told that the neighbor had given him and said that it needed a motor to it. I have the books and things in here. So that
Okay.
when I do try to find, when I do try to find out, oh, wait a minute, was it? Yeah, the screws. And this is what I have to work with to go and try to see about this.
Well, I'm gonna do that. I'm gonna try to make sure you get either a new scooter or they fix the motor for you guys. Okay. So that's if that's what I can do right now, then to help him, live a better life, I'm gonna get to that ASAP. This is what diabetes, and people don't realize that it's not just. It affects more than just the person. It affects the family. And you got this lady who, it almost teaches you a new
true sense of what love really is. That people get divorced. Think about it. People get divorced over the smallest things, and here this woman loves this man to the point where she's just dedicated her life to taking care of him, and they're like kids. Their love is like it just happened yesterday. So we're gonna try to get him a chair and come back and see him, see how he's doing. Hopefully he'll still be around, and